You have your budget for 2016, you've published your service plan today. Can you explain the focus of where the money is going to go for 2016?
Well, the vast majority of the money will go to sustain the services that are already in place. But we have about 83 million to target on new priorities. And in the choices that we've had to make, we've sought to make a real priority out of improvements in our approach to quality and safety, and ensure that we deliver and land aspects of reform, particularly the integrated care programs, which ensure that we provide joined up care to a whole section of our population that we seek to serve, and also to support the real development of the hospital groups and the community healthcare organisations, that they too have quality and safety at the heart of their organisation, but that they're properly enabled to develop in appropriate ways to meet the needs of the populations that they serve. We also have some money for targeted investment. It totals only 83 million, and we're focusing that in particular ways across acute services, mental health, primary care, social care, cancer care, and health and well-being, and also equipping ourselves with some of the ability that we need to manage activity-based funding, which will help us make better use of the resources we have. So across the piece, our priorities really are to support quality and safety, to support reform so that we end 2016 with a service that is changed in positive ways compared to how we will start the year, and also that we meet the needs of specific target groups within our population who currently have unmet need.
One of the points that you've made from your visits around the country in relation to reform is the challenge for staff. Would you like to comment on that?
Well, I think that, and as you say, I've visited many services around the country, and I make it a point to do so, and I'm really impressed by the ongoing significant commitment that is evident every time I visit a place where patients or our clients are being looked after. There's no doubt in my mind of the strong commitment of our staff. And that comes after 7 years of great difficulty with the resources that are available, with many senior colleagues being exited under incentivised programs and other colleagues being asked to take on additional responsibilities without the service necessarily being able to support them in the way that we would have wished. We've done a lot of things to try and support people to adapt to their new responsibilities and to try and bring some stability. And in the last year, in addition, with the end of the recruitment moratorium, we've tried to plug a number of the gaps that resulted from the days of austerity. But I do recognise that it has been challenging. It's going to continue to be challenging. And in particular, the very significant increase in demand for our services that we've seen makes it a daily challenge to meet the aspirations both of our staff and of the population that we serve.
Unlike other years, you're faced with a significant challenge in 2016 by way of the EU fiscal rule that you have to break even at the end of 2016 and that you can't deliver services on the basis that you can expect a supplementary like previous years. How is that going to work for you in 2016?
Well, the fiscal rules apply to the whole of government, but for us, very particular impact is that unlike in all of the recent years, we can't expect to have additional money at the end of the year that wasn't available to us at the beginning of the year. In 2015, we're getting close on 650 million euros of supplementary funding, and there is no way we can expect that to happen in 2016. So the old ways of thinking, the old ways of working, and the old ways of spending are no longer sustainable. Each person with a budget, each manager, each person who spends money in our system needs to understand that from now on they can only spend the money that's allocated. They can't spend money above that they wish they had been allocated. If that happens, there will be a financial crisis for the health system, which will be to the detriment mostly of our patients and clients, but also of our staff. And people who spend without regard to budget will have to be accountable for that. So let's be clear, this is a new set of rules. We do have a budget which is higher than last year. It's modest in its additional resources. We have to live within those resources and spend the money in the ways that are decided in the service plan.
Is the reform programme challenging, and can you outline some of those challenges to us?
Well, I think any change is challenging, but the fact that this is change heaped upon more change makes it particularly challenging for everyone who works in the health service. It is clear that the HSE in its original form wasn't as effective as those who designed it hoped it would be. And this more steady move towards a different system of healthcare delivery, where things relate more closely to the populations that are served, is an important change, but change itself is challenging, and the fact that we need to do this in a steady way creates an environment in which change appears to be never-ending. But it's important to stress that we do know where we're going with these changes, and what we're trying to avoid is running too quickly. So I recognise that that's a challenge, and also providing the necessary resource to make it work is a challenge. But I do strongly believe and encourage everyone to accept that this change will be worth it when we get there.